I'd like to go through the different points that the rotator cuff and the biceps are attaching. And then I want to go through a couple of clinical pearls. So if you get close here, so when you think about the acromion, I want you to think about it as being like a peninsula, right? Peninsula. Okay, and then we could say, here's the front, here's the side, and here's the back of the peninsula. Front, side, and back. And then if she puts her arm behind her back and rests it in the waistband, then the supraspinatus tendon can come out from underneath the acromion, and the tendon itself, after it comes out of the tunnel, can have more exposure for which you can palpate. If it stays here, then there's less exposure of the tendon to palpate. So it's right now, here's the spine of the scapula, the supraspinatus fossa with the belly of the muscle right here, goes through the tunnel, comes out the other side. And it doesn't come out to the front, it comes out not to the side, but halfway between the front and the side. So if this is the peninsula, and that's the side, that's the front, then you're going to look for it halfway between front and side when her arm is like this. Okay, and then I feel something under my finger going back and forth. In other words, my finger's going back and forth this way, and I feel the structure on which my finger's rolling is the tendon, and it's attaching right in here, and I can feel that tendon as my finger goes in the way that I'm saying. If they say it feels tender, and I say they were positive on the test, then I'll feel both sides simultaneously, and I'll say, which is worse? And they say, oh, that left one's worse. Okay, satisfied now? Good, this is the one we have to treat. Okay? So that's palpating supra. Why is it so important and precise? Well, first of all, it's got to be precise if you are going to do a treatment to it. You better know the structure that you're supposed to be on. And then if we're to teach a home program, they have to be confident to find it also. So this is pretty important, that you're confident so that you can therefore teach. Okay, if it's infra, then we have to think of the acromion covering over the greater tubercle, and we're going to expose the infra by going out the rear, like this. So I feel the spine of the scapula, and then when I fall off the end of the spine of the scapula, I drop my finger about a centimeter, and then I can feel a bony prominence right here, which is part of the tubercle. And then I trace the tendon, and I ask her, where on the tendon would you say it's the most tender? And then that would be my treatment site. If it was the subscapularis, I'm palpating during the exam. I feel the coracoid process, and that's the first prominence I feel when I follow the clavicle out and I go right down from it, and there's coracoid. And then the next bony prominence would be the lesser tubercle. And I can confirm that by moving the humerus very subtly while I'm on coracoid, and the coracoid shouldn't move when I move this little bit of glenohumeral. But if I slide my finger laterally to the next bony prominence, and then I move humerus, I should feel that lesser tubercle moving underneath my finger. Then I know that I'm on the tendon, and the subscapularis tendon is a very broad tendon, like fingers width broad. So I'm palpating the inferior fibers, middle fibers, and superior fibers. Superior fibers, in my experience, also elevate, as does supra and infra, for some pain that could be reproduced when the person abducts. And it could be supra, but they'll be positive to the internal rotation test. The reason I'm being so specific is because I'm going to mark the patient for them to do their home program at the area where it's worst. So that would be palpating the lesser tubercle. And then biceps, long head, is coming just lateral to that. And then I'm feeling for tenderness up from the bicipital groove. Okay? Seldom. Supra, infra, and sub are your most common lesions in my experience. Seldom biceps, seldom deltoid, and seldom triceps, long head. Okay, any questions so far?
How about Terry's minor?
No. The ones I just said. Okay? You want me to say them again? Okay, now, that's pretty easy, right? Does everybody feel confident about that, or do you want to practice that first? Okay, you can have 5 minutes each practicing. Then we're going to start treating.